Stronger erections start where the blood vessels tell the truth. Here's the uncomfortable shocker. Erection problems can show up years before obvious heart symptoms in some men. Think of the perineal arteries as the check engine light of your circulatory system. Smaller pipes feel pressure and plaque first. Several cardiology reviews note that erection difficulties often appear about 2 to 3 years before chest pain on exertion and roughly 3 to 5 years before major cardiovascular events, which is why taking them seriously protects more than your sex life. According to cardiology experts, erectile difficulties are now considered an independent marker of cardiovascular risk, not just a bedroom issue. Everything here is plain language and grounded in real research. I'll mention the sources as we go and list representative references at the end. This is educational content only. Bring your questions and your notes to your clinician for decisions that fit you. Starting with what your blood vessels are trying to tell you, most erection issues live in the endothelium, the ultra-thin lining of blood vessels that controls tightening and relaxing. When the endothelium can't release enough nitric oxide, the signal to open up is weak, pressure goes up, and flow goes down. That is why checking blood pressure at home, watching your waist size, and noticing a trend in morning erections over weeks, not one random day, can be so revealing. Cardiology guidance emphasizes that the same risk factors that drive coronary disease, hypertension, diabetes, abnormal lipids, smoking, and inactivity also drive erectile problems. The artery size concept explains why perineal arteries warn first. It's the same disease process, but in a smaller diameter vessel that clogs earlier. If this sounds familiar, the first fix isn't exotic. A brisk 10-minute walk after dinner, most nights, starts to restore endothelial tone by nudging nitric oxide production upward, and over months that habit supports both blood pressure and vascular responsiveness. Many men overlook hydration, sleep regularity, and alcohol creep. These influence endothelial function too. What to watch this week? Your home blood pressure at the same time each day, your average steps, and whether morning erections return as you rack up consistent movement and sleep. A common mistake is to assume it's just in my head and postpone a simple BP check or lipid panel for months. If that reminded you of your sleep, here's the link most men miss. Loud snoring, gasping, waking unrefreshed, or daytime fog can point to obstructive sleep apnea. Intermittent oxygen dips, higher nighttime blood pressure, and sympathetic surges strain vessels and blunt nitric oxide signaling. In men with sleep apnea, erectile difficulties are common, and treatment can help selected patients. When used consistently, CPAP or other physician-guided therapies may improve erectile function scores, alongside benefits for blood pressure, daytime energy, and partner sleep. If your partner notices pauses, or you wake with a headache or dry mouth, do a 1-minute stop-bang self-check. Loud snoring, tiredness, observed apneas, high blood pressure, body mass index, age, neck circumference, and biological gender. High scores are a flag to talk about a sleep study. Short-term tips that help tonight: sleep on your side, limit alcohol within 3 hours of bed, aim for a consistent lights out, and elevate the head of the bed if reflux is part of the picture. A common mistake is saying, "I don't feel sleepy, so I'm fine." Many men with sleep apnea feel wired rather than sleepy. The clue is non-restorative sleep and a snoring bed partner who's exhausted. Now to the everyday numbers that drift upward silently. Metabolic syndrome, abdominal fat at the waist, elevated triglycerides with low HDL, rising blood pressure and impaired glucose, injures vessels and nerves, both crucial for erections. Diabetes exaggerates the risk, in part by damaging the tiny blood vessels that feed the nerves involved in arousal and by stiffening the perineal arteries. When the belt leaps another notch or your A1C creeps from the high 5s into the 6s, it's not just a lab curiosity, it is your vascular system asking for help. Practical starting points: measure your waist at the navel, not over jeans, write it down, and remeasure in 2 weeks. Ask your clinician about fasting glucose, A1C, a lipid panel, and a blood pressure plan you can actually follow. Dietary patterns that emphasize vegetables, legumes, intact grains, and lean proteins support insulin sensitivity. So do strength sessions that train large muscle groups. Even a modest reduction in waist circumference and a small improvement in glucose control may help endothelial function and nerve signaling over time. The common mistake here is to chase exotic supplements before stabilizing basics like daily steps, fiber, sleep schedule, and alcohol. Medications can help one problem yet complicate performance. Handled safely, there are options. Some blood pressure medications, especially older thiazide diuretics and certain older beta blockers, have been associated with sexual side effects in some men, while other classes like ACE inhibitors or ARBs tend to be more neutral for many. Some antidepressants, particularly SSRIs, commonly reduce libido and delay or blunt arousal. In contrast, certain alternatives are sometimes friendlier for sexual function under medical guidance. Hair loss therapy with finasteride can, in a minority of users, lead to reduced libido or erectile symptoms. Most effects are uncommon and often reversible, but not always. The key is not to stop anything on your own. Bring a complete list, with dose and start date, to your clinician and ask if an equally effective alternative exists for you. Options might include adjusting dose, changing timing, adding behavioral strategies, or carefully switching to a medication with a different sexual side effect profile. A frequent mistake is quitting a psychiatric or cardiac medication abruptly. This can be dangerous and usually backfires. The safer move is a structured review with your prescriber, anchored in your actual timeline of symptoms. Hormones matter, but testing right matters more. Low testosterone can contribute to reduced libido and, in some men, erectile difficulties. Thyroid problems, both hypo and hyper, can also disturb sexual function. But guessing from a single low lab drawn at 4 p.m. is a classic error. Urology and endocrine guidance recommend measuring total testosterone in the early morning, typically between 7 and 11 a.m., on 2 separate days before labeling deficiency and discussing treatment. If values are borderline and symptoms are present, your clinician may consider free testosterone and SHBG to clarify. Thyroid screening is reasonable when symptoms suggest it. Fatigue, cold or heat intolerance, unexplained weight change, hair changes, palpitations, or tremor. Evidence shows that treating overt thyroid dysfunction may improve sexual function. 2 important cautions here. First, do not self-medicate with boosters from the internet. Purity and dosing are inconsistent, and interactions are real. Second, if your clinician confirms true testosterone deficiency with symptoms, therapy decisions should weigh fertility plans, prostate health, red blood cell counts, and cardiovascular risk. This is an individualized, monitored decision, not a one-size-fits-all fix. And finally, what your core and saddle time might be doing down there. The pelvic floor muscles, especially the bulbocavernosus and ischiocavernosus, help trap blood during an erection by compressing the deep dorsal vein and stabilizing the base. If those muscles are underactive, or if perineal pressure from prolonged sitting or aggressive cycling compresses nerves and vessels, performance can suffer. A randomized controlled trial has shown that targeted pelvic floor training improves erectile measures compared with lifestyle advice alone. The key is quality and coordination. Think gentle, precise contractions that lift and hold for a breath or two, followed by full relaxation. 3 sets of 10, once or twice a day, is a practical start. For cyclists, reduce perineal pressure with brief, stand out of the saddle intervals every few minutes. Consider a cutout or noseless saddle, dial in bike fit, and avoid extreme saddle tilt. If you feel numbness in the perineum or the tip of the penis, that's a signal to adjust your setup and trim volume until sensation normalizes. A common mistake is hammering sit-ups, clenching the abdomen all day, and calling it core, that creates pelvic floor overactivity in some men and can worsen symptoms. Balance matters. Strength plus relaxation, posture breaks plus movement. 3 moves you can make right away. First, track for 7 days. Morning erections, yes or no, bedtime and wake time, snoring or no snoring, alcohol, cycling minutes or other saddle time, a daily blood pressure reading at the same time, and 1 waist measurement at the navel. Patterns beat guesses, and you'll have a clean summary to take to your clinician. Many urology and cardiology teams consider a consistent drop-off in morning erections a useful signal to mention. Sometimes it's nothing. Sometimes it uncovers something fixable. Second, change one habit tonight. Pick either a brisk 10-minute walk after dinner or a 5-minute pelvic floor set before bed. 3 rounds of 10 gentle squeezes with full relaxation. Add a consistent lights-out time to protect REM sleep when nocturnal erections are common and nitric oxide pathways remain active. Exercise and sleep regularity support endothelial function and autonomic balance in ways that matter for sexual performance. Third, take it to your clinician. Bring your 7-day notes and ask about a realistic blood pressure plan, a lipid panel, fasting glucose and A1C, morning total testosterone on 2 separate mornings, and a TSH if symptoms suggest thyroid issues. If snoring is loud or pauses are observed, share your stop-bang score and discuss a sleep study. Treating sleep apnea, when present, helps sexual and overall vascular health. Quick, real-life snapshots you can use to calibrate. You're 42, snore hard, wake groggy, and your partner notices pauses. Your stop-bang is high. That's not just a sleep quirk. Bring it up. When matched to the right patient and used consistently, CPAP can improve erectile function scores and stabilize blood pressure. You're 36, started a new antidepressant, and noticed lower libido and softer erections 2 weeks later. Don't quit the antidepressant. Ask whether dose timing, behavioral strategies, or a medication with a different sexual side effect profile fits you. You're 55, your waist increased 2 inches, and morning erections faded. Your A1C comes back 6.2%. That's a red flag for metabolic health. Weight management, activity, sleep, and glucose control support both vessels and nerves. You're 48, cycling 150 kilometers a week, and feel perineal numbness. Adjust saddle height and tilt. Consider a cutout or noseless design. Stand out of the saddle regularly, and add pelvic floor training. Numbness is a signal to modify, not a badge of honor. What about nitric oxide foods and supplements? Leafy greens and beets provide dietary nitrate that the body can convert to nitric oxide, and controlled trials show modest blood pressure reductions in some adults, useful for vessel health. Consider them part of a Mediterranean-style pattern rather than a magic bullet. And remember the basics: adequate protein for recovery, fiber for metabolic health, and color on the plate for polyphenols that may support endothelial function. Be mindful if you have a history of certain kidney stones. High oxalate foods may need individualized advice. Be skeptical of instant vasodilator claims in supplement ads. Many products mix unproven or poorly dosed compounds. Interactions with blood pressure pills and erectile medications are real. If you plan to try anything, bring the label to your clinician or pharmacist and ask, "Is this safe with my meds and my numbers?" A 2-minute home checklist you can screen with this week. Take your blood pressure 3 mornings in a row before coffee. The target your clinician sets will be individualized, but trends matter. Note whether morning erections are present on those same days. Measure your waist at the navel and write it down. Ask your partner, gently, if snoring or pauses are a thing. If yes, complete stop-bang. Open your medication list and mark the start date of each drug. Circle any changes in the last 3 months. Jot down a single doable habit to try for 14 days, walking after dinner, 2 strength sessions a week, or pelvic floor work. Then revisit how you feel and what changed. Lightning recap you can remember in one breath. Blood vessels speak first. Sleep apnea is common and treatable. Metabolism and waste matter more than you think. Medications can play a role. Never stop them solo. Hormones count, but test on 2 mornings before you call anything low. And your pelvic floor plus saddle choices influence the plumbing. Catching signals early protects intimacy and the heart, because the goal isn't just stronger erections, it's more healthy years with the person you love. If this helped, drop your age range and the one factor you'll check first. Share this with a friend between 30 and 60 who needs a nudge, and subscribe for the next videos. Morning erections, what they really signal, foods that support nitric oxide the right way, and home blood pressure with zero avoidable mistakes. Final ethical reminder: this is research-based education, not medical care. Use it to guide smart conversations. Testing and treatment decisions should be made with your healthcare professional who knows your history, medications, and goals.